Hey guys, Ben Sherhammer here. This video is going to just go over just a brief overview of BPH, how we work it up and how we treat it, so that when you come to clinic, you'll be an expert on the subject, and that when we sit down to have a chat, you will have all the information that I'll tell you, and so we can, just make some good shared decisions about what you want to do with your care. So BPH stands for benign prostatic hyperplasia. And so what that means is that there are two parts of the prostate. So there's a middle, what we call the transition zone. That's for your urethra. And then there's this outer capsule called the peripheral zone. And so BPH, or benign prostatic hyperplasia, as shown by the picture on the right, is growth of the inner part of the prostate, or the transition zone. Interestingly enough, this part of the prostate grows throughout the course of your life, and actually for a man never stops growing. And that presents issues as we get older. As you can see there, just by this kind of simple plumbing, is that the urethra on the left is open, so the bladder on top, urethra through the middle of the screen, so the bladder on the left is open. The one on the right is not open, and therefore as that adenoma tissue, benign tissue, starts to squeeze in on the urethra there, it makes it more difficult. And so what we find is that over time, your symptoms will include more urinary urgency, so all of a sudden having to go to the bathroom more faster than what you expected, more urinary frequency, so having to go to the bathroom just more often throughout the course of the day because you actually don't empty out your bladder, maybe having to get up more times at night. And all of these are typically symptoms of what we call the benign prostatic hyperplasia, causing the urethra to slowly squeeze down on that outlet, and therefore your bladder is not able to empty as well. So if you come into clinic, and we will work it up with just a few different things. So the first thing is called the IPSS, or International Prostate Symptom Score. This is something you can actually do on your own ahead of time. You can just Google IPSS, find out what your score is, and sort of see where you land. So it'll give you a score of low risk, intermediate, and high risk. And what that means is that just kind of compares you to every other man your age, and looks at your symptoms, and just sees where you fall with that. A lot of times we'll get a PSA test. PSA is just kind of a prostate test, just to kind of help us indicate how big the prostate size is, and has some other ramifications that we can discuss in a different video. And then the last thing is we'll get some office tests. So a lot of times we'll have you urinate and see how much is left in your bladder, so what's called the post-void residual. Sometimes we'll have you urinate into a special device called a uroflow machine, so we can see the rate at which you empty your bladder. And based on all the above, we kind of make a decision about the next steps. So here's the IPSS score, and so you can just kind of briefly look at it, but it's going to ask you some questions like, do you have incomplete emptying, sometimes or always? How often had you had to urinate less than 2 hours, and then you kind of rate everything on a scale of 1 to 5. You can add it up at the bottom, and then you'll get a score. So 1 to 7 is mild, moderate, and severe. And then also you'll go down here at the bottom and just say, what is your overall quality of life? So happy, unhappy, so delighted, pleased, satisfied, mixed, unsatisfied, etc. So all this is just really helpful information that we use to make sure that we're assessing your symptoms properly. So one of the first steps that we'll use is a medication called Flomax, or tamsulosin. Many of you, if you're coming to the urology clinic, have likely already been placed on this medication, and may have already been placed on finasteride. So you may have been placed on either Flomax or finasteride. Those are the two most common medications for BPH that are currently out there. And then if not, then we'll discuss placing you on either one or both of these medications. Flomax, or tamsulosin, is what's called an alpha blocker. Actually sort of blocks the alpha fibers in the prostatic urethra and helps dilate that area, so when you urinate, you can urinate more freely and hopefully less frequently. It does have a few side effects. The most common ones would be, one is retrograde ejaculation, where your ejaculate actually goes backwards into your bladder or some portion of it. And then the second one would be, some people develop what we call orthostatic hypotension. So meaning that when you stand up, because it's sort of a dilatory type medication, some people feel a little bit lightheaded. So those are the two most common. The second one is finasteride. Finasteride basically blocks the testosterone to the prostate, and in doing so will actually shrink the prostate over time. We like that volume reduction, but it does have some potential side effects that have to do with blocking the testosterone to the prostate, meaning that it blocks it to some other parts of the body, and you can end up with some people end up with gynecomastia, so that's enlarging of their nipples, periareolar tissue per se. The other option would be is that you can end up with some low libido, as well as erectile dysfunction. So those are all low risk side effects, but they do happen, and so that's definitely part of the discussion that we do have. And so then beyond medications, we look at procedures, and procedures are just a big part of the management of BPH for us as urologists, because what we find is that as the medications stop working, the next step is basically to open up that prostatic tissue. And so the next video will go over just the myriad of different procedures, because there are lots of them, and helping you figure out if you're interested in taking this next step, what are some of the factors that you would consider as part of that. I hope this video has been helpful, and feel free to continue to look at the rest of the videos on this page so that so you can be well educated. Thanks.